My journey began in 2014. I kind of dealt with it for about a year and a half, and I saw probably 3 doctors in the Northwest Arkansas area. They ended up finding a tumor on my appendix that had burst. After that first procedure, they referred me to another doctor. I had another surgery, and then I finally saw my last doctor in Northwest Arkansas. I just knew something wasn't right. I hadn't felt good for so long, and I just knew that I had to find another option and to figure out what was going on with my body, and that's when I reached out to Mayo Clinic.
Cancers of the appendix are very rare. It's 1 out of a million. In the old days, people would offer surgery for it, but the 10-year survival was only 30%. And a novel concept was developed about 30 years ago where the surgeon would go in, remove the cancer, and then try to treat or eradicate the microscopic disease by basically bathing the inside of the abdomen with chemotherapy. And the thought is that you're bypassing the blood system to get to the cancer directly. The operation that we talk to them about is something called Hipec, H-I-P-E-C. And what that stands for is hyperthermic intraperitoneal chemotherapy. We do Hipec for cancers of the appendix, colon, and ovary. The procedure is philosophically the same. The goal is to remove all visible disease.
When Dr. Bagari explained the Hipec procedure to me, it was something I'd never heard about.
Because Hipec is a complex procedure, you need to, if you're interested in pursuing Hipec, you have to go to a place that has a high volume and the skill set and expertise and support to do it. Unfortunately, there are very few centers in the United States that offer Hipec surgery.
The reason I came to Jacksonville Mayo Clinic is because of the fact that I didn't feel like I was getting the care that I needed in Northwest Arkansas. And Jacksonville and Mayo was my only other option to come to find the answers I needed.
For cancers of the appendix, if you do Hipec, you can almost get a 10-year survival of 70%.
This was my shot to be healthy and to recover, to live my life and to be a mother and a wife and to, see my future grandkids. And so it was kind of a no choice. I mean, this was what I was going to do. Cancer's scary. We all know that. But there's always an answer, and there's always a place that you can go. My place was here at Mayo Clinic. I'm still alive, I'm happy, I'm healthy. I have the rest of my life to live, and it's all thanks to Dr. Bagari and Mayo Clinic.